Aloha, everybody, and welcome to this episode of the Triple F Podcast, Faith and Family First, where we are going to look into what possibly is happening with COVID. Long time since we talked about COVID, but you want to stick around because you want to find out what Jim and I are thinking about COVID in this end of the year. So let's chat about that. Hey, Jim, you got COVID?
Not yet.
Have you ever gotten COVID?
Nope.
So the entire 2 years, you've never gotten COVID?
Correct. Every COVID test I took was negative.
And let it be known that you're not vaccinated. So,
No, I'm not
So
vaccinated.
remember all of the warnings way back when that if you didn't get vaccinated, you would basically be, planning for your funeral. Remember that?
Well, I am planning for my funeral. I'm on Medicare now, but not like right away.
Okay. Well, I would hope not, Jim. We have many more shows to do.
Oh yeah,
yet.
I've got decades, I hope, but I mean, I'm closer today than I was yesterday.
We are. So what I'd like to do today, Jim, and you and I talked about this, is, I've gotten a lot of emails from some of our peeps who watch everything that there is to know about what's happening with vaccinations, what's happening with the hearings that are happening right now with, I wouldn't really call them hearings, but we've got our buddy out there doing his little circuit round. He's retired, or so. Is he retired yet?
Who are you talking about?
You don't know who I'm talking about?
Fauci. Oh.
My goodness. How do you not know these things? But
Ain't my buddy.
Well, I mean, you see all the things that's happening right now with how he's answering questions. Anyway, so a lot of people are sending me things going, okay, what are you guys going to do, if anything, on COVID? And I know you have some thoughts. So I wanted to start with a Washington Post article that came out very recently. So this came out on November 23rd. And the headline says, COVID is no longer mainly a pandemic of the unvaccinated.
That's the Mackenzie Beard article.
Yes, which is a very interesting article. But I'd like to get your thoughts. First of all, just let us have it, Jim. I know you've got some thoughts about COVID, so let it out.
Well, no, my initial take on a lot of things these days is how apparently Twitter kept control of the information on a lot of topics that we were allowed to know. I don't rely on Twitter, and I read things on Twitter, and sometimes I say things on Twitter, but mostly it's like a minor detail. But for a lot of people, that's how they educate themselves. And
our younger generation, that's how they get all their news.
While friends of mine that were Twitter-centric in their understanding of everything were very pro-vax, very anti-bodily integrity, freedom, and I was reading other things, and I was really unable to get them to listen to things that they didn't hear on Twitter. I mean, it was sad, actually, and I didn't realize how sad it was until Elon Musk is now, releasing the backroom discussions on things that occurred during that period of time. So the first take that I have is I'm really glad that we're finding out that the information that was allowed to be distributed was one-sided on a lot of topics, so that hopefully the conversations that we can have now going forward will be a little bit more freewheeling and two-sided with people who only were sticking to the side they got.
Well, it's interesting because I have friends on both sides of this issue, right? And I mean good friends. So I have friends that are very strongly pro-vaccination, and I have friends that were strongly anti-vaccination. And we fast forward to today, and it's really interesting that a lot of my friends that are pro-vaccination, I've asked them, have they been keeping up on all of the, because you have to keep doing that, right? You get your vaccination, then you got to get your new dose. And it's really interesting. I'm seeing the numbers start to fall. So the ones who were really willing to go out there and get vaccinated, and they got their first booster and they got their second booster, maybe their third booster, but by the time the fourth and fifth booster was coming up, I've got friends that are going, Okay, I'm done with the boosters. Okay, and I think when you look at this particular article, that's what they're saying. They're saying that even the vaccination, it wanes, right? The protection wanes. So once you stop getting those boosters, then you're going to be more apt to get COVID. And there are a lot of people to this day that still live in fear. There are people, in fact, in New York City right now, they're talking about reestablishing mandatory masks.
And I think it's intended to be a test of the people in New York City's sheep characteristic to go along with it or not, because the masks don't work. So the only reason to do it is either the medical people in the New York City Department of Health don't realize that the masks don't work, but I'm sure they do because they use masks in hospitals forever. They know what they're capable of and they know what they're incapable of. So there must be another reason. And I think they're testing the complacency of the population. If the people say, HE double toothpicks, I ain't wearing a mask, then they're going to realize they lost control. If people, people in Honolulu are wearing masks again, 2 masks.
Well,
it's amazingly ridiculous.
All I can do is speak to my own experience. And I will tell you that the 2 years where we were wearing masks predominantly all the time, I hated it. Okay, I did it because I was supposed to. I hated it because I tend to get very claustrophobic, and to have something on my face all the time kind of made, especially on those long flights. Oh my gosh, having to wear a mask on a plane. It was terrible. It was horrible
and
for me.
And I actually got reprimanded because I would have it hanging down,
but
not on the other ear. Yeah, they would come by and say, you have to put your mask on your other ear.
Yeah, they really took that. But having said that, cause and effect, I will tell you that I have always suffered some kind of flu every Christmas for the past however many years.
I get a asthmatic bronchitis when I come back from New York on the airplane.
Yeah, it happens but the 2 years where I wore the mask and I did not, I had no flu for like 2 years. So I thought personally, that was super awesome.
I even did for the last 2 years, and it tested negative all the way through the testing process. But I want to share something about it that I thought was very funny. So you're probably not old enough. Were you bikini clad in the 1970s?
Yes, you're going to talk about the macrame bathing suits.
Remember
yes.
crocheted bikinis in the 70s.
Okay, here. So you realize that people listening right now on the radio, there's people our age that are chuckling to themselves, either
everybody wore them
wearing them or teasing people that did.
Anyway, so there was a meme of a girl, I don't know, 20s, 30s. I can't tell because she was wearing a mask. But the point is, it was her way of settling the issue. It was a crocheted. It looked like the bikini, one side of the bikini, And I just thought that was hilarious because that proves many things. Number one, they don't work because the holes are really big on a crochet thing. And number two, if you want to be stylish and comfortable, forget the ones they want us to wear and just wear one of those because it counts. It's a mask equally as effective.
I'm laughing because I think the women in the 70s, I said macrame because macrame and crochet, we did both of them in the 70s. We had macrame.
Correct.
You remember
but that was a harder material.
It was a harder
so I don't
material.
think you'd want a bikini out
Well,
of that.
if you were a woman that was a little bit more blessed in that area, you'd want something thicker, something that would, protect a lot.
What do I know?
But you're right. They were mostly crochet or whatever. But, let me just do one quick segue and then we'll get back to the topic of COVID. I was having a conversation with some youth, telling them that I do know how to crochet. And they thought that was really interesting, about crocheting. And then I found out that this younger generation, especially during COVID, they were doing a lot of things like back to basic kind of things. Like, I don't know if you knew this, but in the first 6 months to 9 months of COVID, there was like a mad rush on people like baking their own bread.
Oh yeah, growing vegetables at home. Sure.
And so I always smile because that's kind of how the Lord takes such a bad situation and makes it good, right? And the same thing happened like with macrame and crochet and knitting. And during COVID, a lot of people took up some of this stuff. I mean, let's be honest, wasn't that how they dealt with a lot of things back in the past when there were no electronic things? That's how people would do. They'd sit by the fire and sew.
That's why Minnesota Governor Whitmer outlawed buying seeds to plant vegetable gardens during COVID because she didn't want you in your yard by yourself growing your own vegetables? I don't know. But remember that? That was part of what she banned.
This is so crazy. Okay, so fast forward to today, and I know that there's not much happening on COVID itself.
There is.
Right.
And I want to go back to something we talked about in the summer of 2020.
Okay.
And if you remember, that was after we were learning that COVID was deadly for older people, obese people with diabetes and other comorbidities. Right. And I shared on our show that I had been watching a local talk show, Island Issues, and they had the director of the Department of Health for the state of Hawaii, Dr. whatever her name was, that left subsequently. And they were talking about it, COVID. And I called her office number. I looked her up on Sunday, and I called her office number and left a message that I watched the show and I'd really like to talk to her. And surprisingly, she called me like Monday, I think, or Tuesday. But it was soon enough that I remembered why I called. And I said to her, you know, I was interested in the show, but the number of positive tests isn't that telling. What I wish you would publish at the Department of Health is the statistics on the level of infection, the symptom severity, you know, hospitalizations, ICUs, ventilators, because that's back when that was the whole thing. And she said, oh, well, it's too difficult to collect that data. And I said, well, it can't be. Because when you're asking the questions you're currently asking to collect the data you're collecting, just ask those other questions. And remember, her response to me
was not happy with you, Jim Hochberg.
Being, what's the word
not
she
belligerent,
used?
But it was something...
It was like I was not arguing with her, but being mean to her or something. I forget the word she used, and she hung up. And to this day, the reason it's relevant, because I pulled out the Hawaii COVID data from the 5th of December, they have never focused on the data that shows the severity of what's going on in Hawaii. And they've been using public policy based on positive test results. And we did another show July or August of 2021 when the CDC announced to the laboratories they had to stop January of 2022 using COVID tests that could not differentiate between influenza and COVID.
And just this week,
do you remember that?
And just this week, the FDA they're recalling some of those over-the-counter COVID tests because they're not accurate. So, and this seems to happen kind of periodically through the whole thing.
So I think what's more important than anything else is that we can't get amnesia. If Honolulu is going to say, oh, we have to have masks again, we need to make the Department of Health, the governor, the mayor tell us, look, quit telling us positive test result numbers. It's meaningless. You can have a positive test and have no symptoms. You can have some symptoms. You cannot be very sick. You can have the flu type. You can actually go to the doctor and be told there's nothing they can do. You can be admitted to the hospital. You can be put on a ventilator. Stop making public policy until the very end information that's useful.
So Forbes, right along those lines, Forbes just did an article that, and here's the title of the article: when Paxlovid is commercialized in 2023, patient access to the COVID-19 treatment will depend on insurance status. So now you know what's going to happen, right? These people that are underinsured or have no insurance are not going to have access to a drug that's supposed to help people that get COVID. So do you think that's going to turn into a public policy thing?
No, not here. It should, but it's not gonna.
Well, so that was my answer to your point of it becoming politicized, because that's what happens. It's becoming politicized.
So what?
So what? I just want people to be prepared
so
that we're not discovered. I mean, we're not done talking about the Rona.
I discovered a fabulous article from December 11th, 2022. And it is about a guy named Edward Dowd who's published a book called Cause Unknown: The Epidemic of Sudden Deaths in 2021 and 2022. The reason that I want us to read that, he's not a doctor. He's not an epidemiologist. And the problem you have when you're arguing medical stuff is the Twitter problem. Some of our friends only believe Fauci and his position. Others only believe the other doctors in their position because it's medicine.
And
right?
you saw the doctors that were silenced on Twitter that were opposed to everything that was going on.
Absolutely. In fact, Simone Gold was not only a leading treatment physician early on in COVID, she also got sentenced for being part of December.
Okay, well, you're going to have to change my mind, Jim
January
Hochberg,
6th.
because I don't like listening to non-physicians about medical stuff. And you're wanting to quote an article from a guy about medical stuff who's not a doctor. So change
let
my
me
mind,
tell you
Jim.
about Mr. Dowd. He's retired. He lives on Maui.
Okay.
So you got to like him. Your dad's from Maui.
That's true. Dad, just for you,
See, I
will give
knew.
Jim just a little bit of headway because he's from Maui, but you have not changed my mind yet. So change my mind, Jim.
So he retired as an analyst and a fund manager with BlackRock.
Okay.
And he managed $10 trillion in assets. So why should we listen to him on medical stuff?
Yes, why should we listen to him?
Very good question, and that's why I like the article. And please read the article, look at the book. It's called Cause Unknown, The Epidemic of Sudden Deaths. And the article is published in the Epic Times. So he looks at the data from insurance companies before COVID, during COVID, and since 2021.
Now, how does a person get access to insurance claims? That seems kind of fishy to me.
I said data.
Well, yeah. How do they access?
Because the
obviously
insurance companies publish the numbers, not the people,
right?
But the numbers.
Okay.
And so he looked at group life insurance numbers because group policies are mostly workers, young people that are working, and group policies are very inexpensive because you give all your workers the insurance and the policy, but they have to still be working when the injury or the death happens to get the benefit. And since people working are usually young and healthy, the cost of the policy is low because the insurance company doesn't really pay as much as a regular life insurance policy, which is no matter what you're doing, when you're dead, you get the money, as long as you keep paying the premium, right? So he looked at group health insurance, group life insurance, disability, which is also employment. So he's looking at the 18 to 60-year-old healthy population, and he noticed that in the data, it's amazing. You really got to look at this thing. So usually the group that gets those group policies, those ages, they underperform in policy benefit receipts. They don't usually get like 30% under. But as COVID hit, it started changing a little bit. But from 21 to 22, when the vaccine was out, it jumped hugely. So he's asking the question, does this data provide evidence that the vaccines are making people disabled, having people die where they're in the group policy and they get the death benefit because they're still working, but they got the vax and the updates and all? It's incredibly interesting. And I urge us to really look at it. Now, he's kind of going a little bit overboard using crimes against humanity and stuff like that, because the way the U.S. government set up the COVID vax structure, you can't sue them. Which is one of the reasons that I never got vaxxed, because the experiment hasn't yet finished, and I didn't want to participate in the experiment if I can't sue them if it goes bad, like I have a problem, heart myocarditis or whatever. And so that's the main reason I'm not vaxxed. It's not because of anything other than I'm not the kind of guy that participates in the experiment. I wait until the experiment's over, and I ask my doctor to look at the results of the study and tell me if my biology is a person that I fit in or I don't fit in, right? And so I think the crime against humanity label is a little bit over the top, but he's not a medical guy. He's not even a health guy. He's not even a health policy analyst. What he did for a living, and he did it very, very well, is he noticed trends in advance of other people noticing the trend in investing, and he would move into that area before other people. And then when he started making profits on the trend that he moved into and the other people started moving in, then he'd be looking at the next trend already. So he's looking at the trends in these insurance data.
Now,
and he's looking in backwards, so he's not moving because of it. But he's saying, wow, when I use my trend thinking on these historical trends that broke at certain times related to COVID vaccines, I think we really need to do some deep medical research into whether the vaccine themselves is responsible for these young people getting the benefit of these group policies.
Now, nationally, we know that there are some congressional people that want this kind of information out, which is once the Republicans take over the House, I know that there is some talk that they're going to start having some hearings about this kind of stuff. I know that I have a lot of friends that did COVID, that got the vaccination, and I don't know one person who had a bad experience because of the vaccination, except one woman. I'm not.
We know
gonna name.
Several actually. They're friends of Janet's.
Well, you might, but I know. I'm talking about me personally, and but your circle isn't as big as mine on those that got vaccinated, though. I mean, I think that
I have
my
no
circle.
idea. I don't ask people.
Well, I just trust me when I say that I'm in the circle where most people got vaccinated. So I think my pool might be bigger than yours, but I will acknowledge that this one woman, her situation of getting the vaccination, and she knows it's the vaccination. Her doctors know that it was the vaccination. So I think that we would be irresponsible if we said that, or if anybody takes the position that the vaccinations caused zero problems, because I think that it's not true.
Well, you can't say it because the experiment's not done.
Well, but it doesn't matter. The point is knowing people, and that's the thing, is people that actually say, I know somebody who knows somebody, and the number of young people
athletes
who have been affected
Division
with myocarditis.
I and professional athletes.
Yeah. So I guess what I'm saying is I'm saying that whether or not you read the article that you just referred to, somebody somewhere should just look into this and give us the real and stop playing politics with this.
So
stop playing politics. I don't care whether someone is a Democrat or Republican. I just want to know if there's a safety issue that we need to be concerned about in this community.
States, I think Missouri and Arizona, sued and they took Dr. Fauci's deposition. And I sent you the transcript.
No, I know. And
did you look at it?
I did. And did you see how
he
many
was
times?
a Hillary Clinton? I don't remember.
I don't recall.
I mean,
recall.
give me a break.
And you know what? No matter what you say about Dr. Fauci, the man has always been somewhat intelligent.
And by the way, if any of our folks say on the YouTube or the Spotify comments, I'd like to read that. Can you put a link to that deposition of Fauci so people can read it for them? And what a deposition is, it's lawyers in a room with a licensed court reporter. The court reporter has this little machine that's not really a typewriter or a keyboard, but it's kind of like a teletype thing. And they type in every word that's said. If you say, or whatever. It comes in. It's a transcript verbatim. Right. The lawyers ask Fauci questions, and he answers. And it was hours long. And he reminded me. It reminded me of Hillary. No, I don't recall.
No,
I don't recall.
It was very scary. And I think while I was reading that, I always do it connects me to other articles, and then I read. And through that process, I came up with a influencer who was talking about that particular deposition. And in that, he showed a clip of these two beagles, these two dogs, that were laying down on their side, and their heads were in this container. And
with the fleas.
With the fleas.
That's old news.
I know, but
you didn't know about that?
I'd heard about it, but I get so much information. I don't make the connection all the time right away. But I saw that, and then I was like, not the sand fleas, and the two beagles, and they removed the beagles'
vocal cords so they
couldn't make noise.
Correct.
And I was like, okay.
But that's science. I mean, science for all the makeup that you've ever worn. It's always like that.
I know that, and that's my point. Is that we go through our life every single day, touching things and drinking things and eating things, and we can get mad about COVID. We can get upset about the way that it was handled. But I think we have to start being a little more akamai on everything we do. So now I'm spending a little bit more time looking at the ingredients and the companies that make my makeup or my shoes and all that, because I'm starting to realize I don't want to be a hypocrite. I don't want to be a hypocrite. If we're going to be upset about this, we should be upset about everything. But I also do not want to turn into one of those people that I'm afraid of everything, right? I just stay in my house all day. So definitely don't want to do that. But all right, well, are there any final thoughts you have for our listeners and viewers?
I would like our viewers, either viewers or hearers, radio or TV or whatever, blah, blah, blah. The Department of Health in the state of Hawaii continues daily to publish on their website the number of COVID positive cases and all that stuff. And so don't skip looking at that, especially if they're going to start requiring that we succumb to their orders with respect to COVID again. The symptoms from COVID, by and large these days, I think, are the same kind of symptoms we used to have from other viruses before COVID that we were not required to wear masks for. And being required to wear a mask, if you don't want to wear a mask, should be prohibited. They should not be allowed to order you to wear a mask if you don't want to wear a mask, if it's like what we used to have before. I mean, yeah, there would be Asian tourists that would wear masks in Waikiki, and I didn't know if it was because they were sick or because they didn't want to get sick, but who cared? No big deal. So if you go to the Department of Health, they have all kinds of graphs and all kinds of things, but they're still reporting as of the 5th of December, the change in the number of cases, positive test results cases, 1,371 in Hawaii. The 7-day average daily in cases, 182. The 7-day test positivity, 6.5%. Meaningless information. It's not going to help you live longer. It's not going to keep you healthy. It's meaningless information, and we have to get the state of Hawaii to quit making public policy based on this meaningless information.
And can I say this? And I'm probably going to get some. I probably will get a few hate emails or whatever. But I mean this when I say this. If somebody wants to wear a mask, leave them alone. I'm watching people attack somebody because they want to wear a mask.
No, we shouldn't be attacking anybody.
If somebody wants to wear, and most of these people that I'm referring to tend to be a little older, and they go to the store and they wear a mask, and they say they're treated badly by some people who will say to them to their face, "Why are you wearing a mask? It doesn't work."
I wouldn't do that to
whatever.
an old person. They're at risk of getting bad things. I wouldn't even do it to a young person.
That's my point. We don't want the government telling us what to do. But we shouldn't be telling other people what to do either. If somebody wants to wear a mask, let them wear a mask.
So we started with Twitter. Let's end with a minute about Twitter so people understand. Twitter is a private enterprise. It's not a public utility like the electric company that's regulated. So Twitter legally can probably ban all that kind of stuff, and you don't really have a constitutional First Amendment right to complain. You may have contract rights or other things. But when the Department of Justice or the White House, maybe candidates and parties, but probably not candidates and parties, when they're involved in managing the suppression of speech on Twitter, that's a First Amendment constitutional problem, and that's what it looks like happened. So I would say stay tuned, and hopefully the Democrats that liked the old way and don't like the Elon Musk way, hopefully they don't come out and say, yeah, put Elon Musk in jail, because he's not the guy that did it.
Well, you want to stay tuned because next week we're going to be celebrating Christmas. All of us are doing our last minute Christmas shopping. We're preparing for the holidays. Jim is going to be flying to New York, but he will be here to do a show next week. But we want to make sure you stay plugged in. Make sure you share, like, subscribe, hit that notification button so you know every time we upload a new video. And stay tuned, people, because we've got some exciting things not only coming up for Christmas and New Year's, but starting in 2023, Jim and I are going to do some very, very exciting things. So we will see you all next week.
And I would say joyously, with all the joy you can muster, await the coming of the Christ on Christmas Eve.
Oh, come, Emmanuel. We'll see you next week. Mahalo, everybody.
Aloha.